tell us some of the changes. We're here for your son, Jerry, who had has had multiple sclerosis for like 20 years, right?
Yes. About 20.
Yeah, and he's in a wheelchair right now. But tell us some of the changes that you've noticed. He did the procedure about 48 hours ago, and what have you seen so far?
Well, the first thing we noticed, his feet warmed up. Even down here in the heat, his feet were cold. And as soon as, after the procedure, he said, his feet are warm. And if we get back to this hotel, we're going outside, and he was telling me that his feet are roasting. Because he wasn't used to the heat here. And now that he's got circulation in his feet, in his legs and feet, his feet were really warm. And before we came down, of course his left hand he hasn't been able to use. His right hand, it was to the point it was starting to shake quite a bit. But like something like this. Yeah. After the procedure, after the procedure, it's calm as can be.
It was sick bad.
You couldn't feed himself?
He could, but it was hard for him. It was like this. It was like this, and then down.
No problem.
How was it before? Show us so we can say, so to speak. This is before and it was like
It used to be really bad.
really bad.
Like
all the time?
I would brush my teeth and I would get the toothbrush right in the eye sometimes. Yeah, so, but now, a lot smoother. I can do this. Couldn't do that before. The left hand still has a ways to go. I used to play guitar, so my left hand was extremely nimble, and that just lost that 20 years ago.
And what else about the speech?
I noticed it yesterday afternoon. I said, Jerry, I said, your speech is better. And by last night, it was really, really clear. Where before that was always a mumble. So there's a big difference there. But the most exciting one is that he peed the bed last night. First time in 15 years able to...
Now say that again. First time in 15 years he was able to go without a catheter?
Yes. Oh, yeah.
First time in 15 years.
Yes. Now, it was involuntary in a sense because it's during the night, but he woke me up and said, okay, I need to use the bathroom.
3:30 this morning.
3:30, and they said, I think I peed a bit, a little bit. And that's something that's never done. It would have been impossible for him before. So, of course, I got up and I made him use the bathroom, and then I looked around, and sure enough, he had peed a bit, which he would not have been able to do before. So I said he had put that on Facebook, and my wife says, "You better not make a habit of peeing the bed."
It's okay this time.
It's okay this time.
Now,
Lift your arm.
let me ask you a question. Lift your arm.
Lift your arm.
You could not lift your arm before.
Okay, no.
No, nothing.
It's pretty well always there.
Like this.
So it's starting to improve.
And
This,
Yeah.
you couldn't do that before?
not very easily. Just steady. I always shook a little trembling.
Now, you mentioned that he was trembling like that, huh?
Yeah, he was trembling like this, trying to feed himself here like this.
And let me ask you a question. You said his legs, he's able to move his legs. Can you
saw
show
him.
us how?
Well, before I noticed he lifts his leg up like this.
And you
I don't
couldn't
know.
before. You couldn't before. Just flat, dead.
That's a big one.
How did you find the doctors in the hospital
I found him great.
and the treatment? I mean,
Yes.
when they did it in the cath lab and so forth.
Yes. Now, at first, when I came here, of course, you're always a little skeptical. We came there, and we came very early, so nobody had arrived. So you look at this place, and the people didn't seem to know too much about it. But anyway, so you're always.
When you say the people, you mean there's the people hanging around?
Yeah, like the people outside, I guess, but.
But they don't know anything about what we're doing.
No, they don't know anything.
Nothing.
But as soon as you showed up, and we went upstairs, and we seen the facilities, and then we seen the staff, and we were then, quite impressed. But after they started the procedure, and we watched most of the time, we were really impressed. At that time, we said, these people really know what they're doing. Like, you can tell. And we were, every time there's something on internet or whatever, you get the feeling that you're always scared that you might get ripped off. And that was our feeling. But when we, after my sister and I watched the procedure that they did to Jerry, we both agreed that this is something that was really, really worth it, and they knew what they were doing. This is the feeling I had. And we were to Poland before. They did antiplasty and
Or liberation therapy.
the liberation
Right.
therapy, and the competency of the staff here impressed me. In Poland, there was just one doctor that wouldn't work on, and 15 minutes it was all done. Here, it was quite an operation, or whatever you want to call it, procedure, and we watched the whole procedure from start to finish, and I videoed it, and I was really impressed. I said, they have done, in my mind, everything they possibly could do to help Jerry. And this is what really impressed me and made me feel that we have done the right thing. And I am glad we came here.
Oh yeah, same here. To me, to experience something like this, I was so amazed at that procedure. It was, Jerry's laying there, you can see his big belly. And to actually sit there and watch the doctors do what they were doing, I felt I was experiencing a miracle. I really do. Just to see all that stuff happening, this wasn't possible 25 or 30 years ago. And to see something like that taking place, I said, wow, I was really impressed. I mean, it was something that, it was amazing. There's no other word to describe it, to saying that technology that stuff wasn't available, let's say 50 years ago. There must be a reason.
So how do you?
Oh, sorry.
Okay. How do you feel about it?
I feel great.
You feel great?
A little better every day. Like initially when it was done, it felt the same. It wasn't a real big thing, but Millie actually noticed my speech. First thing she noticed. The next morning she noticed my speech was way better. We noticed my tremors were gone. I could lift my left arm a little better. Before I couldn't do that.
Wow. So would you recommend it to other people with MS to come down here?
Absolutely.
How did you feel about the hospital, the hotel? We're in the hotel now. It's a little informal setting, but I hope the people watching this will.
Oh, absolutely. I highly recommend coming down and having this done, because Canada or the U.S. don't offer this type of professional service. Like, this is unheard of. This is cutting edge to do this type of thing. And we've always been on the cutting edge, like always looking for new things to try, and we always also have to be cautious and leery of getting ripped off. Somebody trying to sell us.
But if people ask you, is this some kind of rip-off or scam down there, what would you tell them?
No, not from what I've seen at all. No, definitely worth the travel and the effort for this.
You guys came all the way from where to Santo Domingo?
Canada, Eastern Canada.
Eastern Canada, all the way down to Santo Domingo.
Yeah,
Wow.
they still had quite a bit of snow there. Yeah. But,